I'm Dr. Sridivya, Fetal Medicine Consultant in Rainbow Children Hospital, Visakhapatnam. Now, today I'm going to discuss on fetal growth restriction. What is fetal growth restriction? Failure to achieve the genetic growth potential is fetal growth restriction. In the normal terms, if the estimated fetal weight of the baby or the abdominal circumference of the baby falls under less than third centile for the period of gestation, we call it as fetal growth restriction. In the fetal growth restriction, what are the causes of the fetal growth restriction? Maternal causes, fetal causes, placental causes and unknown causes. Maternal causes. In the maternal causes, constitutional. If the mother is small, the baby also will be small. And maternal malnutrition, medical disorders complicating pregnancy, diabetes mellitus, chronic hypertension, cardiac diseases, kidney renal diseases, autoimmune disorders like SLE, hematological disorders like thrombophilias, maternal smoking, alcohol, drug abuse. Coming to the fetal causes. Among the fetal causes, chromosomal abnormalities like trisomy 13, 18 and 21, multiple pregnancy. In the multiple pregnancy, there will be increased demands and infections, torch infections, toxoplasma, rubella, cytomegalovirus, herpes simplex and syphilis. Among the placental causes, in the placental causes, placental insufficiency and abnormal cord insertion, cord abnormalities, the placenta previa, the circumvallate placenta are all the causes in the placental causes. Now, types of fetal growth restriction. Early fetal growth restriction and late fetal growth restriction. Early fetal growth restriction, if the baby has a growth restriction at less than 32 weeks of gestational age, it falls under early fetal growth restriction. If it is greater than 32 weeks, it is late fetal growth restriction. In early fetal growth restriction constitutes to 20 to 25% of the cases and late 70 to 75% of the cases. In the early, the placental disease is severe, while in the case of late, the placental disease is mild. Immature fetus, in the early fetal growth restriction, immature fetus has a tolerance to hypoxia more. And in the late fetal growth restriction, mature fetus, the tolerance to hypoxia will be less. The perinatal mortality and morbidity in the early fetal growth restriction is more, while in the case of late, the perinatal mortality is low, but there are poor long-term outcomes. In the diagnosis of fetal growth restriction, and mainly by the clinical assessment, symphysis-fundal height measurement and ultrasound measurement, and by using the ultrasound. In the ultrasound, serial monitoring of the at-risk fetuses is done by ultrasound. In the ultrasound, we check for the fetal growth, what is estimated fetal weight, what is the blood flows to the fetus, what is the fluid surrounding the fetus, and what is the fetal heart rate and the position of the fetus. Coming to the management, in the management, we should aim at the prevention first and then treatment. In the prevention, we have to ask the patient to stop the smoking, alcohol and the drug abuse and improve the maternal nutrition and also the prevention of the torch infections. And in the management of the fetal growth restriction, we do it by the ultrasound monitoring by the fetal Dopplers. By the changes in the Doppler abnormalities in the umbilical artery, middle cerebral artery and the ductus venosus, we see changes in the Doppler. By assessing the Doppler changes in the umbilical artery, middle cerebral artery and the ductus venosus, we plan for the delivery. The main goal of the management is to maximize the gestational age of the delivery. In this, by the Doppler, we can stage them into stage 1, stage 2, stage 3 and stage 4 based on the Doppler changes. In the case of the stage 1, we do the weekly monitoring in the Doppler and plan for delivery at 37 weeks by labor induction. In the stage 2, we do bi-weekly monitoring and we plan for the delivery at 34 weeks by cesarean section. In the stage 3, we do monitoring of the Dopplers every 2 days. We deliver them at 30 weeks by cesarean section. And in the stage 4, we do monitoring every 12th hourly and we deliver the fetus after 26 weeks of gestational age by cesarean section. Thus, ultrasound is a good screening tool for Doppler for the management of the fetal growth restriction and for the management of the fetal growth restriction. So, ultrasound should be done at a good place by the trained physicians. Thank you.